This week on the BackTable podcast.
This is the other thing I've been thinking about a lot is subtraction and running lean. So the first part that we've been talking about is all about ways that you could be lean in your practice. Like really look at your employees, look at your bottom line. Everything has value. By the way, I got rid of my shredder because I was really pissed off. It was $170 a month. And I was like, and I realized you only have to have a cross-cutter shredder. I got rid of the shredding company. I got a shredder in here and my people shred. Now, I trial it. If they hate shredding, then I get the shredder back. But I look at all these things like high and low. So the point of subtraction is it doesn't equal doing less. This quote, to attain knowledge, add things every day. To attain wisdom, subtract things every day.
I'm your host, Dr. Behati. I'm coming to you from Tacoma, Washington. My guest today is Dr. Mary Costantino. She's the medical director at Advanced Vascular Centers, which now has multiple locations. We'll get into that a little bit. And the coolest part is she's like an hour away from me, so I go and see her all the time. It's so much fun. So, Dr. Costantino, thanks so much for being on the show again.
Thanks for having me.
So our topic today is keeping it lean. How do you keep your outpatient practice running lean, but still running functionally? And this is kind of an episode that came in response to another episode, which was talking about a lot of regulatory requirements in the OBL and ASC space. So Mary, maybe you could kind of, first of all, I want you to kind of give me like a little update on your practice since the last time you've been on the show. It's grown quite a bit. And then we'll kind of take it from there.
Well, I don't think my practice has grown. I think BackTable has grown from like 100 episodes to the content is, 400 episodes or something. And what you guys have done is amazing. Since the last time I was on, I got a partnership up and going about 2 hours away in a place called Eugene, Oregon. That's a different entity. So that is a partnership with vascular surgery, nephrology, and IR. That's its own realm of joy and complexities because I'm in a partnership agreement with them all. But I still have maintained 100% ownership of my little basement joy here. And I think that we just continue to do the best critical limb work we can do and the fibroids and veins. I did add a PA. I had a PA and she moved. And then I felt like I was going to drown. And so she started in January and now I feel like I never work. I don't know. It just seems to be extremes, but I have really great people. So, when they go away, I feel it. And when they're here, I feel that too, which I guess is a good intro into keeping things lean. We have a site for DVA. So that's exciting. We're a trial site for a device for DVA. We were a site that we did the first in man in a medical device 2 days ago, and we're doing some more patients tomorrow. We're also part of an outpatient research group called ORCA. John Rumbach called me, and the concept was things that we in the outpatient world have known all along. We're doing all these great cases, and there's all this data, and this is what we need this day and age is data. And so ORCA developed, and I got it, Dr. Rumbach really started it all. And now companies are really utilizing the OBL space to do trials. So that's exciting. So like below-the-knee drug-eluting balloon trials, and we're the principal investigator site for a distal protection device. And that's all born out of just the love of the job. But so it's always exciting, always new, always different. But we can do these things because we have a stable base from which to branch off.
Yeah, and I think kind of like leading into our topic for today, the fact that the regulatory requirements to kind of start a trial in the outpatient space are so much easier to navigate for industry, for doctors, makes it a really appealing place to do research, actually.
Yeah, I was on a panel at ICIT, and Costantino Pina was doing a case of a below-the-knee. Abbott's got this, the tibial stents that are bioresorbable, which I haven't used, but I have 2 of them. I'm waiting for the right case, so I'm not promoting them or anything. I don't promote anything necessarily. So if I say anything that seems like bias, it's not, because I just speak. But they have these. I've been really interested in using them in the right case. And so Dr. Pina did a case of it, and you have to refrigerate these things. That they have to be kept at 77 degrees. And I was like, well, just go down and get a refrigerator and plug it in, turn it to 77, and that solves the problem. And there was a little bit of like, I wouldn't say outrage, but Like that could never happen. And I won't say the university that said that. And I'm like, we're literally talking about a refrigerator.
Yeah.
That's the barrier, right?
Oh,
in order to
but
get
I totally believe that. I believe that there are like multiple barriers in a hospital to getting like a small fridge in your control room, for example.
Yeah. And I think that what Orca has done that's nice is that the reason I never did research before, I am kind of a research-oriented person. I always ironically thought I'd work at a big university my whole life because I do like investigating and knowing, like, what are we doing? And are the things that we say we're doing really what we're doing? And I've always liked that. But I also don't really like binders upon binders upon binders. And that is just the world we live in. And so binders make me want to quit. And so what we did with Orca was we hired a person with a PhD in, a PhD type person to kind of run these trials. And it's made it really, really easy for the doctor. So it's amazing because we can do the good medical work and not have the whole regulatory. It's all being done. And people fly into my center and they do all the regulatory things that need to be done. But for the physician doing the cases, it's taken that barrier away. I always like solutions to barriers that I have.
Oh, yeah. Yeah. Like make it as easy as possible. Okay. So that really brings us to what we're talking about. All right. How do you keep in compliance with a lot of the regulatory requirements for an OBL, but without hiring like a team of administrators to do it?
Well, what you do is you look at what the requirements are and you think of ways to do it that don't require a team of administrators. And so, as you know, I've been reading this book, The Makers and the Takers, which I've done my prep work. I actually have a whole I have a whole thing.
Okay.
Notes on this page.
Oh my gosh. Yeah.
And the book.
Yeah.
Because I have so many thoughts about this that I wanted to try to be concise and not rambly. And it's hard because this is such a broad topic, right? So if we're specifically talking about regulatory things and, do you have to have quality assurance programs? I've been buried with these things. And I'm like, this is meaningless. Sure. I have hand washing. Sure. Somebody want to count the door ding? Sure. But what really helps me, I want to know a radial artery is still patent. Guess what? When I was in the hospital, I would actually see the patient's back. And when I started doing radial artery access, and nobody had a radial artery. And I said, well, why is this? The protocol in the hospital was completely wrong. It was like complete compression for 2 hours, right? It really came from a cardiology world where maybe patients were older and there must have been a bleed. And so then it became a very compressive world. Well, nobody in the room knew how to look for radial artery patency afterwards. They put the device on the thumb, looked for the oxygen curve and said, oh, it's patent. And nobody bothered to compress the ulnar, right? So you're looking at these systems, these binders, this regulatory stuff. And is it actually helping the problems that we have? I think also running this business, I have this, like, if you're not helping me, you're hurting me. You're not fixing my problem. You're fixing a problem. You're not fixing a problem. You're telling me this is a problem. It's not one of my problems. But I can do that because I know the medicine really well and the business really well, right? And so where I think in the beginning, people come to you and say, you need this. And you think, oh my God, everybody else has that. I probably do. And you actually really don't. So another thing that I learned in my hospital era was I remember doing like a CT biopsy on whatever, the third floor. And I was told I had to fill out all this paperwork, and I did it all. And it was just like, gobs of it. And then I went down, I did a procedure in the ultrasound, and I went to do that paperwork, and they're like, you don't need this. Both of those places said that they were JCO requirements. This was maybe 13 years ago. So I started to think about, what is JCO? A JCO requirement is just an interpretation of what JCO is, right? So when you get a binder for accreditation, they'll have something. And then what happened is your center has to interpret how you're going to execute on that requirement.
Okay.
Right?
Which is insane. It's kind of like taxes. It's like guess.
Yeah.
Yeah, like guess, and if you get it wrong, fail. Yeah.
That's right. And this is the same with financial evaluations, pro formas, right? So when you start to watch people do these things, which are incredible. I mean, I have this Josh Johnson who speaks at the Business Institute now because I watched him pull together a pro forma. We were struggling in our second center and wondering what could we do? We looked at the operations, and then I'm not a CFO. I don't know how to do this stuff. I mean, I have a lot of respect for people who can take numbers and put them all into a box and try to spit out some answers. And you realize when you watch that process and you spend the time going through and seeing if you change this box, how that changes everything. And you realize all of this is interpretive. Life is just one big interpretive dance, really.
Yeah.
and that's, I think, the message upon like being lean and running with value is that it's all everybody's best guess at interpreting the intent of a requirement. And so this is where it comes to, management companies, but sometimes they'll make it right. So peer-to-peer, right? Peer-to-peer review. I've looked into this a ton. Are there certain sheets we have to fill out, a certain formats to do that? So a management company, everybody has to do peer-to-peer. So what does that look like? The easy way, I worked for a big radiology group where once a month, these little boxes popped up and you said, do you agree or disagree? And you rate them 1 through 4. Okay, then I went away and I had my own place and I had to figure out a peer-to-peer system. I researched it entirely. I did lit reviews, like, what do we have to do here?
Okay, a peer review system. Got it. Okay.
Yeah.
For a second, I thought you were talking about insurance authorizations.
Oh, no. Like,
got it. I see.
Did you do a good job at your case?
Peer reviews. Yep.
Yeah, and I realized nobody really cares what you do with this, as long as you have some sort of system that you can put in front of someone who said, yeah, I would check this box. The reality is that's exactly what's happening in a big management company that sends an email that says, please check one of these boxes. The intent is that we have a forum to discuss cases and actually be better. But that's not what it's become. It's become, oh, I have to check this box. How do we do it in the least amount of time? Okay, so I've taken that and I'm like, well, what's the intent? The intent is this. Is this worth doing? Yes, it is worth sitting down and discussing cases. Okay, well, let's do it in a real way. Let's add to that. Let's add time to that. So part of running lean, I like more kind of value to a practice into clinical medicine and doing things like keeping us interested. And so we can pay anywhere between 4 and 20% to have somebody make us click those boxes faster, to have you produce more RVUs. And then we're all going to want to quit at age 55.
Pretty much. Yeah. Yeah. So that's kind of what it seems like. Like when you get involved with a management company, for example, is they want to make things as standardized as possible across all of their centers, right? Even though they're not the owners. But in order to do that, they'll impress upon you a way to do something that doesn't really fit in with your clinical workflow and doesn't really provide any benefit. Yeah. So how do you do it when you're on your own?
Well, the good thing about being on my own, and this is something I've learned along the way, I mean, I have made every mistake in the book, and I've decided who are the valuable people in a healthcare interaction. It's a doctor and a patient. Outside of that, I'm not saying there's no value to them. I'm saying what brings in money. So and I thought about this from a hospital administrative standpoint. Because we have strikes here in Providence. You probably have all heard about the strikes, and all of our anesthesiologists were left off. And we don't have subspecialists around here. I mean, we have shortage of subspecialists and surgeons, and so it makes you think, what is happening? What are we doing wrong? As a person who runs a business, I'm also paying lawyers and consultants and all of these other people. And I think so. My lawyer friends are like, just increase your billing, just increase your hourly. I'm like, yeah, well, it doesn't work that way. I've got to worry about Medicare. We may not be getting Medicare checks in a month, I have to constantly worry about this. And the lawyers kind of build their practices and then say, well, I've reached the peak and now I'm going to bill you, $1,400 an hour and take cases I want and don't take cases I don't want. That's not how we work. We serve the public. So, when I thought about how hospitals around here have really screwed it up, and I sit at night and think about, what would I do if I were running that place? I would say it all goes down to the basics of where's the value. The value is in the doctor's brain and then the patient walking through the door. Outside of that, everything can add to that or take away from that, but that's the crux of of healthcare. It really is. And we need to remember that. So then when around my center, I've decided build the center around the physician, right? And I built a team that understands that value system. It's not I'm more important of a person than anybody else here. We are in the practice of medicine, which means the medical information that I know, and now obviously I have staff who know a lot of medical information too, and that patient coming to the door with a disease state, it starts there. And you have to be okay with that dynamic. We're taught how bad that dynamic is, right? We're taught as physicians how bad we are, and we're always in trouble, and you were too pushy and you were too this and you were too that. And I mean, I always had a pleasant relationship with everybody I worked in hospitals, I think. But, the write-ups I did get were like, I asked for lidocaine too fast, or one time I wore a sweater in the cath lab. And I look at that, I'm like, I cannot even imagine my lawyer friends walking into a courtroom and being written up for you put your water bottle in the wrong place. So we built this system that is like particularly demoralizing. And when you have your own OBL, you can flip that on its head really fast and say, let's build around what we're here to do, which is deliver healthcare to patients, individual patients. And if you have everybody on that bandwagon, then the pieces all fall into place. So I would say that's the most important thing about being alone. And that's the same with Eugene, you with the second center, is that what are the personalities of the doctor? And then just build your team around that. That's what companies do. If you've got a founder of, a cracker company, everybody is built around that founder's ideas.
Yeah, and the founder needs to have like a clear vision and be able to articulate it and then instill the goal of getting to that vision in their employees. Because if you
That's
don't have,
right.
it's like this whole like stakeholder thing, right? Like if they're not active stakeholders and they're not going to be delivering care to the way that you want them to.
100% right. And this has been where I've talked to some people. This is an interesting place in OBLs now where, because, I think you and I have probably talked about this, where locums is so lucrative now. There's a way to kind of keep your foot in two doors. And I didn't really have that. I would call it a luxury, but is also a blessing in disguise. I dove in knee deep and didn't make any money for a whole year and barely any the next year. But what I did was I sat down at my desk and I worked. And if it's too comfortable, then you're not going to have that drive to do all the things you need to do, right? So this is also a philosophy of value and running lean opportunity cost, right? So if I'm outside of this lab doing a week of locums, I'm not watching what's going on here. And I've learned this in their second centers that it's really important to have the person who is sitting and running the ship, like the quarterback who's a physician. I think it's important to have the physician who's doing that. Where the larger management companies, what they do is they make the physicians interchangeable and they put that management structure in place so that no matter who's coming through the door, and that's okay too. It's just not how I operate and it's not how this center operates. But I understand the need to sort of protect the system from a less known doctor or, a more interchangeable physician.
I mean, no offense, but I think that's like basically just working at a hospital or a radiology group once you get to that level. Because like that's the whole reason we're independent is because we want to shape the way we deliver care, right? All right. Well, I feel like I've said too much, but tell me a little bit more about the notes you took on makers and takers, which should not be confused with the book I almost bought, Makers versus Takers, which is definitely not the right book.
Ali sent me a picture last night of a book about Jesus.
Yeah. It was a very Jesus-y book. Yes.
She said, is this the one you were talking about? I was raised Unitarian, so that was not the one I was talking about. The middle says lean equals value because I don't really love the idea of lean. And it's really about value. And so that makes it an individual process, right? So what you can't do is say, oh, how do you run a lean lab? Oh, I make sure, we don't order too many snacks, or I just make sure I get $100 less on every device. That's not the answer. It's much more philosophical than that.
That's like the millennial equivalent of like, don't drink your latte every day and then someday you'll be able to afford a house,
Right. My friend told me a long time ago she said, what's costing me a lot of money isn't the latte, it's the $35,000 school tuition. And I was like, yeah, pretty much. As you would know by, all the children you have, which I think is great. Mine are almost out of the house.
Oh my God. We're like on different ends of the spectrum. I got 2 in school. 1 is waiting to start school. Yeah.
God, I look back on that and I just think, I look back at you and say, how do you do it? And I think I did it, but I can't even, it's a blur. But it is great to do all the things.
Well, it's because you did it and I just took your beta. I took your hack and I just fixed it to be and now I just do that. Yeah.
Well, my current life hack is that once you get to my stage, you can do all the things. So I'm taking like all these trips this year and I'm learning how to maintain this business and take like real vacations and seeing if I can find a moderate that can last for the next 20 years. Cause I love the work I do.
Yeah.
So we think about, we're always talking about retirement, but why can't we find a place? I love pushing catheters. I love treating people. Like, why can't I find a place where I can do all the things? So the first thing I did was I booked multiple trips to all these places I've been wanting to go for 20 years. And I don't regret putting them off. I think it's just what you give up to have children in a big, time career. So I think that there's a couple prongs that stick out of this lean equals value. I'll go through them. One is financial. It's the most obvious one. That really starts with a cash flow, thinking about cash flow. This is the obvious one, right? And the number one thing about cash flow is your employees.
Yes. That's going to be your biggest expense, you mean?
That's right. And
Okay.
and they're the biggest investment in your center, your biggest expense, and the most costly to you when you don't have a stable set of employees. And including just their salary, you also include their benefits. So healthcare goes up 30% every year to cover these guys. I spend so much money on health insurance. And then I do a 401k match. I do all the things. So it's not just the salary, it's the 30% extra cost for everybody, and figuring out where is it worth spending that money. Are you having more entry level people? Are you having more experienced people? And that really is your own personal decision. For me, I make those decisions of who's going to provide the best customer service out there and how am I going to feel great doing procedures. Meaning I'm going to have experienced people helping me because I like it better. For me.
And you can have like fewer, more experienced people, right? Because they can fill multiple hats. And like in your office, really, like everybody is a Swiss Army knife, to borrow a phrase from Don Garbett. And that is kind of like one of the things is like employees can't be really siloed in an OBL. They can't be like, oh, I'm just the front desk person. Like, no, you might have to scrub cases. You might have to room patients. And having people understand that that's like really different than in the hospital where like the scheduler is a scheduler. That's a really big benefit of working in the outpatient space.
Yeah, and my employees tried to do that for a long time, and I just didn't let it happen. And I had to be very firm about it. I mean, we had people do pre-authorization, and I lost hundreds of thousands of dollars. I mean, I had so much money getting patients on the table without having the correct pre-authorization. The revenue cycle management, I didn't understand that at all. I didn't even know what RCM stood for when I started. And so this is where, people think, well, if I had patients on the table, I must be making money. And nope, not necessarily, as you know, right? And so when we had to shift an office manager shift, and then my new office manager actually managed a nail salon, and she was hired as a front desk person to answer phones. She's very smart, right? So like I've taken people and I kind of hover around them and see what they're good at, just kind of instinctually watch them work. They're all entry level for a little bit. Watch them work. And then I try to like place them where I think they would like working and try to get them off that front desk. That's a hard job. So we then hired a person who did every pre-authorization was like $15 or something. There's people who will do that. And she made a lot of mistakes. And then they disappear. They got no skin in the game. They're like, sorry, I screwed this up. You won't know for 4 months, but then it takes you a long time to figure out if they actually know what they're doing. And by the time you figure it out, either what you do is you go try to, we'll do some training, and then they still don't get it right. So, these people are costing you so much money every time that they get something wrong, because we're in the era of mediocrity. Everybody's mediocre these days, and
we've definitely talked about that, you and me.
Yeah.
It's true.
Me and mediocrity. That's what everybody is all about, me and mediocrity. And so what I did was I basically insisted that somebody in our office, i.e. this office manager, this front desk person who I was kind of building up to be office manager, learn everything about pre-authorization. And that was a big pushback. And I was like, no, you just have to learn it. And she did. And she's a rock star for it. Now, the other thing I don't do is I don't give people raises for jobs that they're going to do, right? So I'm not your I'm not your extra, I'm not your community college. I'm not your extra, college course. I will give you a raise if you have extra responsibility, but I don't say, so as an employee mentality is, I'm going to have this new job. What's in it for me? I'm going to, you're going to pay me more. And I'm like, no, you haven't done the job yet. You don't even know if you can do it. You don't even know if you like it. So I'll train you. I'll invest in you. I'll invest the time. I'll invest you going to whatever you need to go to. And you're welcome for that investment. And your pay will increase when you're actually doing the job. And I learned that too, because I'm generally I started a very giving person. And it's kind of like my first nanny. I was like, don't do anything, just take care of the kids. By the third nanny, I was like, why am I coming home and doing all the laundry and doing all this? And I was like, look, you got to be me when I'm not there, right? And I like this. I also do counteract that with tons of freedom, tons of like, what do you want to be happy? You know, they want something to order something, they want lunch, whatever, order it. You know, so I don't run a super hard line all the time, but when it comes to people's responsibilities, and this goes to the Swiss Army knife, is that I haven't let people say, well, I only do. And everybody in this office knows they better not say they're not comfortable to me. I am like, this is not about your comfort. This is about medicine and delivering care. Saying I'm not comfortable says, I don't know how to do this yet. So I hate the I'm not comfortable. I don't know why we allowed that verbiage to creep into the American healthcare system. And it's kind of like you say that, and then everybody's supposed to bow back down and be like, oh, we just want you to be comfortable. So here's another example. My PA can do sedation, and my nurse called out sick yesterday. And we have a problem with that, right? Not with her. She's allowed to have 6. That's not a problem. The problem is then we can't do cases. So instead of having my PA, have a whole day of block time to figure out where she needs to be filled in on being able to do sedation, I said, I need to know specifically what it is. And what it was just making sure the medication doses are the vials, that she understood the vials and the medication doses. So I just took 3 days of block training to like click on paperwork and follow the nurse around to what is the real problem? But I had to push for that, right? I had to like push and say, well, what is it? What is it exactly? I need to know exactly. Well, I don't know if I'm ready. Well, what exactly makes you not ready? And I think when you do this, you end up with employees who are really capable and really interchangeable. And then you can think outside the box with them. There's another organization that uses MAs to scrub, and that's brilliant. Like, why do we have to have rad techs? I've got a great rad tech. I can't even think about doing a case without him. But if I didn't,
he's pretty great.
He's pretty great. If I didn't, I mean, something like a Eufy, it's the same thing over and over. So, but I use somebody who's really great. Okay, so that's employees. I've also found that things that make me stop right away my tracks and say we need to change direction is when employees say we need to hire more people.
Oh yeah, that's a big one. Yeah, yep. Or like I'm overworked. It's like, well,
right. And then if you say you're overworked, then I need to look at your job and figure out how to cut out 30% of your job. That's my first reaction. I'm working too many hours. Okay, what about the system is broken that's making you work that many hours? Because I was forced to basically have my hand in everything here, I started opening the mail. When you open the mail for your center, you'll learn a lot. And you start to see where this time goes, right? So certain companies will send packing invoices and invoices for every single box that's shipped. If you put an order for 10 products, they ship 1 box at a time. That means 10 cardboard boxes come in your office. 10 pieces of mail have to be opened with invoice slips. 10 pieces of mail have to be opened with invoices, faxed to your bookkeeper, who's then got to enter in 10 invoices. So imagine what you order in a month.
Yeah. Oh my gosh. Yeah. That's like so much manual labor that like does not need to happen. Yeah.
That's right. And then if you're a bigger company, your bookkeeper is just paying invoices because they come through, right? And so I'm in a smaller company. So how do we have a system where that invoice is even checked against what we have coming in? So somebody would say, well, we have a great system that scans this and scans that. And oh, by the way, it's only $1,299 subscription every month.
Wow.
Right?
Yeah.
Or whatever it's going to be. People love subscriptions. Other companies love subscriptions because you can never drop off of them. Am I boring you?
Not at all. This is great. Yeah,
okay.
Keep going.
Okay, because that's only prong number 1. Okay, prong number 2 is more on this is a side prong to that. Never let your guard down. Rotate department to department. And everything needs to be reevaluated in cycles of 2 to 3 years. Okay, this was learned. So I had a human resources platform called Gusto. Or Gusto, however you want to say it.
Oh, yeah.
That was how we did payroll. It was really easy, really nice. Mm-hmm. But then they grow. So all of a sudden, their requirements get bigger and they become more complicated. And they were really great at running payroll, but not so great at, keeping up with the tax issues with every state. Or they tried to then offer health benefits, right? Because they wanted to be a full HR platform because that's their company growing. And I didn't need that. Like I have a healthcare benefit. I have a health benefits person who does our benefits. So when these other things grow, now we have to relook at this system. And then we say, okay, this is still a good payroll system, or this has changed and isn't suiting our needs, right? You take your kid to a pediatrician, eventually they go to an adult doctor. Or when they become an adolescent, maybe they need a different doctor. So change, this idea of change. On the same token, things that can be really disruptive, meaning change in an EMR, is a very disruptive. I have not changed my EMR ever, despite all the people who are out there with EMRs, because what I've decided to do is to double down and push my EMR to its maximum capacity, invest in my own EMR. And EMRs are expensive. So I'm about $3,000 a month at an EMR because they charge per provider, which I hate that word provider, but that's how they charge. And it's very robust. We were using a small fraction of it. So I tasked the same office manager with, goals of 2024, turn this EMR around and start to get a streamlined practice. We inherited the EMR and we just were sort of piecemealing it together. So never let your guard down in any of your systems and rotate departments. I had a friend who was a CEO of a tech company. A lot of the friends I had, I'm still friends with them, but they've all made cajillions of dollars and they're all not working anymore. So,
oh no, now you're the poor friend. Oh no.
Oh, I'm definitely the poor friend for sure. Oh yeah, I'm for sure the poor friend. I remember they all had tech companies downtown and 15 years ago. And one of them didn't have a desk. And he said his desk, when it was like a 20 to 30 person company, was each week he sat in a different department. Oddly, I don't even know how I remembered that. But in thinking about this stuff, I'm like, oh yeah, now I know why.
Makes sense.
Because you really have to keep pushing each department. Value, prong number 2, emotional. Running lean is making sure one patient doesn't feel like 10. So this can happen with one very, let's say, needy patient, either emotionally or their procedures complicate, whatever it is. It's usually emotionally. It's not usually the procedural stuff. We're usually very good at handling complex procedures. It's the very emotional. It's the pick who is extremely upset about everything in the entire world. And so I try to run lean. We're there where we deliver the care that patient needs so that they feel heard, taken care of, loved, all that. But it doesn't bring my staff down, right? Because I got to protect my staff from things that are unnecessarily draining them. And so the way I do that is if we have a patient like that, first of all, I'll absorb the brunt of it. I can usually identify them and then I will run point on that patient. So that looks like instead of in here dictating, I'm out there literally. In fact, 2 days ago, I sat at a patient's bed. She had very minimal disease. And I was literally standing at her bedside for maybe 45 minutes because what I was doing was I was basically being like, almost like a physical blockade.
Yeah.
To my
you
staff.
were like babysitting her. Yeah. So your staff wouldn't get it.
Yeah.
Yeah. I mean, but how can you do that and still get, I don't know, all your work done or manage your other patients too when you're...
You don't really need to have that many patients. That's the thing is that if I do 5 angios now, probably with a cut, 6 real cases, that means complex vascular or embolizations a week, that's enough for me. So that's the other thing is that there's so much FOMO of hire all these people so you could push catheters all day long. Wait, how do you build your practice? And I'm like, well, I don't have that big of I just do what comes along. And I don't spend a whole lot of time worrying about it. I guess that's how this run lean thing comes from. And so when people are telling you, you need this, you need that, translate it all into how many more cases you're going to have to do, right? This is like if you buy a house. If you buy a house, it's $5 million. How many more years are you going to have to work? And the problem is that we have this visual because of the way a lot of people talk and you'll see posts on Twitter and whatnot, where we all think the other person's out there doing 15 cases a day. Sure, if you have $500,000 overhead every month, you need to do that. If you don't have $500,000 overhead every month, you don't need to do that.
Yeah.
It's really that simple.
Yeah. Yeah. Keeping your costs low. Yeah.
I make a great salary and have a great life. And honestly, last year, I feel like I didn't even know how much I made to the end of the year because I pay myself a small salary. When I found out how much I made last year, I said that I basically felt that I was probably working too hard and I needed to give everybody raises and hire more. I was running too lean. It wasn't preservable for me. Could I do it? Yeah, I proved I can do it. I've been doing it forever. But I was like, okay, this isn't good. I don't need to make this much money. Other people might take that much money and be like, oh, let's go on vacation. I was like, oh, wait, this is a wake-up call that
I'm working too much. Yeah.
Yeah, that I don't have that balance right. Mm-hmm. There's no longevity in being imbalanced. I kind of hate that word too, balance though, and wellness. I hate those words too. It just makes everyone feel like they're failing all the time. Okay, prong number 3.
Yes, I'm ready for it.
Are you bored yet?
Are you kidding me? That you're saving me from reading this book about Jesus. It's great.
Oh, I have underlines. Everything underlined. Prong number 3 is opportunity cost, which we talked about before. And this is kind of what you were talking about, leadership and vision. OHSU, our major hospital, just lost huge leaders that brought in a ton of NIH money. You know, we got the Phil Knight Cancer Center, $500 million of Phil Knight's money for Cancer Center. And they just lost their number one guy for NIH money because of lack of leadership at the executive level. And in order for these guys, I mean, these are lifelong OHSU people. So this is true whether you're a small company or a big company. The job of a leader is to have vision, is to protect your people and have a healthy corporation. And I think about that all the time. What leads to corporate health, right? If you have a healthy corporation, you have stability for your people. And that can look like anything. That could be your vision. That could be your facility. That could be, do I have enough operating money, right? Corporate health means that you're not I'm not going to not get checks from Medicare for 3 months and then go under, right? That I have a backup plan. And that's the job of me. That's the job of the leader. And if you have a CEO, that's your CEO's job, is to figure out how you have corporate health. A lot of people are going to tell you what that looks like. Really only, I'm the only one who decides that for my center.
Yeah. And I mean, most OBLs, do they just have the physician leader as the number one person, right? Or do a lot of places have their own CEO?
It's really different. And I've always been really jealous of people who've had CEOs because I don't know that I do this job better than a CEO. I mean, let's be clear on that. I'm just here, just try my best, I'm just a girl.
You're just some lady that does angiograms. Yep.
Yeah.
You're like me.
Yeah. And so I think that when I love talking to CEOs and reading and hearing, and they have such great skill sets, but they're all real different too. It's like if you go to a doctor, one doctor doesn't equate to the next. So how do you find the one that really understands you and understands your vision? And I mean, this is the same with anything in that C-suite level. And the problem is there's just a lot of people say they're in that C-suite level who where you feel like, okay, hey, take over this. And then that's not really, doesn't really align. And then a year later, they're gone and you're left holding the bag of what. And so that's the problem. It's not that knowledge isn't better. I mean, again, I look at some people I've met, and the CFO, for example, I mean, so impressed. And I love hearing good CEOs talk, or people who talk about leadership. And I've looked very hard to find things in leadership and how to be better at this. This is not stuff we're taught. And it's really hard to find. And when you do find them, they're these prolonged courses and they're expensive. I mean, I'm not going to pay $50,000 to go listen to some leadership, especially when I'm doing just fine by myself. I would like to know more, but not that badly.
Yeah. Yeah, I always wonder about the return on investment of something like that, doing what is it called? An executive MBA or something like that. But part of that is just doctors inherently, we just want to get more degrees,
Right.
We're we need more. But I feel like it's kind of a little bit, I mean, and I've only been doing this for about a year now. But it's trial by fire, It's totally trial by fire. You make a lot of mistakes. I have lots of friends now that reach out to me, just like I reached out to you. And they're like, I want to start an OBL. And I'm like, hold on, buddy. Let's talk about this. It's awesome, but these are all the things you should know. And I don't know that if I had more advanced degrees or I had an MBA that I would have not made the same mistakes or, been where I am now. I don't know.
Yeah, I remember when people would call me and I've pretty quickly was saying, if you can be happy where you are. It was when that big OBL versus hospital, there's so much dynamic, which is just so exhausting and annoying and unnecessary. It really is very unnecessary dynamic of this battle. I mean, no better way to take down a specialty than have infighting amongst ourselves, right? So, I basically am if you're happy at your job, and it's because every job and every group is different, and you can be perfectly happy. This is not an OBL versus academics. I mean, nothing, this is just, hey man, if we can all find ways to strengthen IR, that's what we need to do. IR's leaving in droves to go do diagnostic work. We're not going to have IR around to the degree we need to. So I have a real clear, that's my goal, is that IR is the best we can be as a field. And so if you're happy in your job and you don't have to leave, then just stay there, right? Like people used to think that OBLs were just this utopia because people on the podium would say, make a lot of money and barely work. No, man, it is not like that.
People on the podium still say that.
That they should not. It's not like that. I have a great life, but I've worked 24/7 for years. And I like the work, though. I'm not complaining about it. But no, they shouldn't say that. It's not like that. And it's going to get worse and harder because the cuts are more and more, and they're going to continue.
Agreed. Did we hit all the prongs?
So no, not even close. So opportunity cost. So you have to understand the direction of the practice, and you have to understand the goal of the practice, and you have to be a good leader. If you don't understand the direction of the practice, you can't visualize the opportunity cost of waste, right? So this is an example. If there's too many nurses, okay, here's a great example. Here's a perfect example. We had a nurse, a PA, and a front desk person here with one patient in recovery, and that patient wanted coffee. So the nurse and the PA were both recovering the patient and sent the front desk person to get coffee. And then I walk out, I'm like, what are you doing? Getting coffee. Okay, now we have 4 people involved in getting our patient a cup of coffee, right? That's small, but scale that. And then if you know, okay, hey man, this is a very highly functional PA. Instead of worrying about coffee, let's get you going over here. And any one of us could get the coffee. But what is everybody else doing? That's a phone that's not being answered. That's I'm not opening the mail, whatever. I'm not saying it's a dollar value, right? So that's the other thing is people say, oh, that PA could be putting a port in. No, there's no port to put in. But can she be spending time going back through patients or whatever she needs to do, right? So everything that you do, there's an opportunity cost to everything. There's also an unintended consequence to everything. And I think if you think of with every action, there's an equal and opposite reaction. There's always an unintended consequence. So when I approach a problem, when I approach a solution to a problem, somebody says, here's a solution. My first thought is, what's the unintended consequence that's going to happen? Can I figure that out? Usually I can't, but at least I can think about it.
Yeah. Like if you brought on another surgeon, for example, unintended consequence.
There's no space. I have to have more MAs. I may do things differently. And I've learned this from bringing on the surgeon, and the people in the community saw radiology reports that were different than mine. Okay, it never occurred to me that a surgeon doesn't have radiology report training. Never occurred to me. I didn't even think about it. We're dictating ultrasounds. And I'm like, oh, wait, you've never gone through he's an older guy. I don't know what they do now, but he never went through the findings, differential diagnosis recommendations training, right? So I had to learn that. And I only learned that a year into it when I was starting to get some phone calls of like, we're not really sure what to do with this ultrasound.
I see. Yeah, unintended consequences, man. That's the rub.
Yeah. The best offense is a good defense or something.
Sports.
I don't know.
You just said
or
sports words at me and I stopped listening.
It might be opposite. The best defense is a good offense.
If you say so. I don't know. All I heard was sports. Go ahead.
Okay, prong number 4, be honest. This is important in value, and it's important in running lean. Here's an example. The Argonne guy came today. He brought billion of donuts. I've never met him. Somebody told him to come by here and bring a bone biopsy kit. And I said, oh, I've never known about I don't even know what stuff you have. And I said, do you have a minute? He had driven down from Seattle. And I'm not going to try to pretend that I don't have time for him. I do. I made time for him. Go get your stuff. If you wait an hour, I'll be free. We can spend some time together. I looked at all of his stuff. In my head now, I know everything that Argonne has, and I know I don't need most of it. It's tip stuff. We went through every single thing, and I'm very honest with him. I'm going to need a filter occasionally. I may use a gooseneck snare occasionally, but most of this stuff has no role in an OBL. I'd like to have a relationship with you, but you don't need to email me in a week and follow up. We don't need to have 14 conversations back and forth. And that's not just to preserve myself. That's also to preserve him. He's trying to do a good job being a good rep. He's a year into the vascular world, and it doesn't help him for me to lead him on, for me to have my inbox filled, and for us to have more lunches. That's not honest, and it's not nice to him. Right? So honesty is really important, and it really helps you. I think people appreciate it. And we're so into like soft landings these days, right? And you can do it in a way that's just, I think people appreciate honesty of like, hey, it's just like saying no to doing a procedure on a patient doesn't need it.
I getcha. How do you be honest when you have to give negative feedback to an employee or something like that without hurting their feelings?
This is where I am terrible, as you can imagine.
Oh man, because you're like me. Darn it.
Yeah. Well, so one thing that I have is that office manager that I told you has built this culture. I mean, you know her. She's built a culture despite me, not because of me, despite me. And she's built a culture where they all like love to come to work and care about each other. And so that's something that I guess a positive unintended consequence of seeing her and saying like and I've tried to raise my employees up in salary and title so that if they ever do leave, they can go into a job that is equal to where they should be, right? So if you've been working at a front desk for 2 years, you need that title to change on your resume and your salary to go up. And, honestly, people may move for family reasons. They may not want to work here. I think is it Branson Virgin Richard guy said, treat your employees as something and they don't leave. I don't know. Do you know that quote?
I know Richard Branson, but I don't. I'm about to Google his quote.
It's like treat them in a way they don't want to leave. So, but I think that if they do leave, you want them to reflect. You want their resume to reflect what they're accurately doing. And as somebody who runs a company, I know if I saw you were the front desk for 7 years without any real increase in pay or title, then that would be a red flag for somebody who wants to come in at a higher position. So I try to keep people's resumes and titles growing so that they can lateral into something in another place or
That's
even
smart. Yeah. So you're not necessarily giving them like a gigantic raise or anything, but you're changing their title a bit so it looks like it reflects the progression that they've made in their job so that they could make a lateral move. And also, I found the quote, train people well enough so they can leave, treat them well enough so they don't want to.
Yes.
Sir Richard Branson. Yes.
Yes, that was it. He's the Virgin Airlines guy.
Yeah.
Yeah. So if you can identify what they like to do and then feel like where they can run in your corporation. And so like we didn't have marketing for almost 3 years. We had nobody. And because we didn't have anybody who was really interested in it and we didn't really need it. And you can't force people to do things they don't really like to do. And generally so my next hire is going to be somebody. And in fact, we hired a front desk person who's super creative. And she put this little sticker from her Cricut. You see that?
I can't really see it. I can kind of see it.
It's the logo.
Oh, wow. Cool. Yeah.
Yeah, she did
That's
that on
neat.
her Cricut and put it up there one day. Yeah. And when it comes to raises and bonuses, so how do you give negative feedback? So first of all, we have this culture that was created despite me. One thing I learned this year, because we did well last year, was I wanted everybody to have a raise, a good raise. I don't necessarily, I struggle with the raises and the bonuses a lot because I have to have corporate health, right? So every individual always wants to make more money, but you have to have corporate health, which means, sure, I can go give you guys twice as much. Well, maybe not twice, but we won't be here next year. And I know that this group is interested in maintaining jobs here. So I decided this year that instead of going up, what I had done is when people had more responsibilities, I gave them raises. So my tech was working for one doctor. Now there's 2 doctors. After 6 months to see how that worked out, I walk in, here's your raise. That was easy for me to do. This is the great thing about owning your own practice. You don't have to run this by anybody. My nurse, remember my front desk person who was really not super stoked about learning pre-authorization, who's now a revenue cycle management guru, who, by the way, can now go run revenue cycle management at any company. So I've loved that she's adapted this skill set. My nurse, likewise, was terrified of accreditation because she worked in hospitals and was like, I can't compete with Jaco. And I'm like, yeah, you can. You can do it. I knew she could do it. She just needed the confidence to do it. Okay, she did it. She nailed it. I think she actually enjoys it now. That's raise worthy. And so it seems it's not just like every day I decide. I kind of think about things annually. Cost of living raise of about 3%. I'm good with that. Some people want 5, 6, not my employees, but if you Google search, that's a lot. But you have to have a living wage. And I think when people say they're going to leave and you offer them more money, they'll stay temporarily and still leave.
That's like a really good point. Yeah. It's kind of like a threat. And then you put a Band-Aid on it, but they're still unhappy. So they're still going to leave. That's the thing.
If somebody says, well, I can make $4 an hour more over there, I'm like, well, what do you not like about the job that I can fix? If I can't fix it, I had a nurse who hated calling in prescriptions. She was a cath lab nurse and she liked doing the sedation and she liked rolling them out into the recovery. And she felt tormented at the job of having to make pre-op and post-op phone calls. She actually ended up working for industry. So being honest. Okay, next prong, I think we're on 5. Oh, no, we've already talked about this. When to add resources and when to eliminate resources. So running lean doesn't mean being cheap at everything. Running lean means, so for example, my staff, I want them to be happy. We have a big food culture around here, as you probably remember. They have the credit card. I basically was like, somebody said something about snacks. And I said, here's the credit card. Get whatever you want. I want to hear 0 about snacks. You need to walk around to every single person, ask them what they want, order 1 billion truckloads from Costco or wherever you want. Just don't talk to me about snacks because my brain is full with other things. And what I decided was I was going to give it a year and see what it cost if 7 people have full reins. And it was like, I don't know, $3,000.
Awesome. Yeah.
Right. It's
and
not
they,
that
and then
bad.
they had control, they had autonomy, and they were like, oh, Dr. C cares about us.
That's
Yeah.
right. And if one of it, like we have people who only eat protein, we had vegan, we have a lot of sparkly water culture, we have a big coffee culture here in our little ABC. So I thought, that's a place, this is an obvious kind of dumb example of adding a resource. It's not about eliminating resources or making sure people don't take home the like M&Ms. I basically can't be bothered to even think about that. Let's see. Okay, this is an important part about the financials. This is off the first prong. It takes time to build the patterns for your practice, and it takes about 2 to 3 years, right? It's the first 2 to 3 years, it's the first year that's the hardest, because how do you pivot if you don't have solid information? And this is because of our healthcare billing. So if you're selling watches, you know how many watches you've actually sold. We sell a watch and then we may or may not get paid for it. And it may be in a month and it may be in 9 months. And 100% of people who start OBLs call after 5 months and they're like, I should have collected and I haven't. And then you have to go look at your system and say, where are the holes? It's like whack-a-mole. Well, you don't have enough stability for 1 or 2 or 3 years to really absorb those whack-a-moles very well. So this is what you do instead of doing locums is you sit at your desk and figure out where are these holes. This is what management companies will say they pay attention to, but no management company could be good at everything. They're not going to be great at marketing and great at revenue cycle management and great at systems, meaning phones and EMRs. My phone system, I can pull up and tell you how many calls went to voicemail. It's not hard to do. You just have to log on to your account. I've got a really good IT guy who set this all up, and I spent the time to learn it instead of doing locums,
Hey, man, don't hate on the locums. You can do some of that stuff while you're on locums with how good the jobs are now, I will say.
Actually, that's true. All you need is a computer. No, I think if I had been in a different era, I would have for sure done locums. I feel like I was tormented to a degree that I didn't need to be tormented to.
Yeah. Yeah, but now you're helping the next generation. So there you go.
I'm trying. But yeah, so like it takes time to build these patterns. So where it's like you're 6 months in and you're like, oh my God, what is everybody doing? It's like what pattern is around the finances of your company? And how do you have projections and pro formas and business, a pro forma is just fake news.
It's amazing how much of it is just made up, like just pulled out of your butt. Like, I think this is how much this is going to cost.
Totally. It's all made up. It's not based on any data. And it's really hard to get the data to build those performers. And the people who do these, the venture capital, private equity people, the management companies, I mean, unless you're managing multiple labs, when they look at your individual lab, things like how many patients can you do in your space? They're going to ask you, and that number could be 2 or it could be 4. And that's a big difference, right? And so what that performer looks like depends on what angle they have with you. Do they want to buy you for very little money? Well, then we're going to alter these things. Do they want to buy you for a lot? I think that being honest, again, hopefully you find people are honest, but you realize that all of this it feels so personal. It feels like as if doctor, like the business owner, we're doing something wrong. And you realize that this is just the world of business, that it's all this amorphous blob of like heterogeneous liver. And somewhere in there may be...
That was like the most IR analogy I have heard today.
It is. It's like this. You go in there and you're like, I don't know, is it cirrhosis or diffuse hepatocellular disease or Wilson's? I don't know. It's a blob. And you try to sort it out. And I think feeling like there must be something everybody else knows that I don't if people stop thinking that way and know that you are smart enough to know any of this stuff, but it is a lot. And all you do is chip away at it. This is why I started the Business Institute. I actually asked Erin if I could even talk about it because I don't want anybody to think I've got some unintended, motive here. But
yeah,
this is why I started, because you just have to start to learn these things, and any IR is capable of learning them if you're paying attention to like people and humanity and your thinker, if you're a thinker. And some people don't want to do this. They want to go get a paycheck, go home. Great. Love that. Lots of jobs like that. But when I was maybe 2 years into this, I was feeling really demoralized of like, I've been at this for so long. It felt like so long. So I bought the practice in 2020 and I wasn't really running it for like another year or two. Right. So I was in it for a while, and all these mistakes I was making, and mistakes were being made around me. And it wasn't until maybe, I don't know, mid 2021-ish that I really took it all over. And after another year, I was like, maybe I'm just not, maybe the universe is telling me I'm not cut out for this. Like, it can't be this hard. What am I doing wrong? What am I doing wrong? Like, I must not be the right person for this. I must not be the right personality for this. And I was listening at the time, there's a lot of bad business books. The business books are not usually very helpful because they're too dumb. They're too dumb. They have one point and nobody's going to sit through 250 pages for that one point. And it's really hard to find podcasts that like get to the point. And so, but I did listen. It was like Business Wars. And it was like, I listened to those a lot. And the Uber guy, he was 6 years in his parents' basement.
Wow,
I remember listening, I'd be like, wait a minute, we're used to immediate results. 2 years is not bad, but it felt like an eternity. And I felt like a failure. Like, why can't I do this better? Why is this so hard? What am I doing wrong? And what it was is I just had to learn a lot still.
Why didn't you give up?
I mean, wow, that's a great question. Wow, you stumped me. That's impossible
Sorry.
to do. You stumped me.
If it's too personal, we don't have to talk about it.
I love what I do. I can't imagine. I mean, I'm like so unemployable. I love what I do so much. And I do worry about what comes next because things are too easy now. Right. And I guess part of it is just this. I had to come to terms with it being okay to be a workaholic. I decided one day I was like, I'm a workaholic and I'm okay with it. Because people give you this message that we should be doing all these other things. And I would book classes and whatever and never show up. I like this work. I think it's interesting. It's why I do all this consulting stuff that I do. I'm not out there because I need the extra whatever money is going to be thrown my way. I do it because I love device development. I think it's interesting and fascinating. And we're so lucky. We're so lucky to have this high degree of expertise in a field. We are so lucky to have that. And I think if you do things because you love them and you do what you still like to do, then all of these things maintain excitement. And part of me does want to say, like, walk out and close the door and be like, maybe I should go sit on Cape Cod and do whatever. But I also don't want to lose the momentum. You climb up that mountain and like, why aren't you going to do some jumping jacks? You're at the top of the mountain. I'm not saying I'm at the top of the mountain. That would be like very egotistical. I've climbed over the tree line because you never know what's ahead.
You're at the apex. You see like all the work you've put in and everything you've built and how it's a mature practice. Like, you have a mature practice now.
I do.
Now I got to just wonder, like, are you happy with what you built? Do you love it? You love coming to work every day.
Well, yeah. I mean, I can't believe it. Like, but I also, I think part of this is, to be honest, like coming in the same time that I'm almost an empty nester, right? So my youngest is 4 months from being out of the house. This was an unimaginable feat for me. I have boys. Like, this is 17 and 19. This is an unmanageable position. And so I look back and I did everything that I wanted to do in terms of the PTA. I mean, I'm doing recycling, I do the Boy Scout stuff. I'm doing grad night. I've done the best I could and everything I could with the kids in their school and run this. And people always say, you need to relax. You need to take your, but I love what I do. I love doing the morning hikes. I love Boy Scout camp. I loved it all. And now I feel like I feel great about it all kind of coming to a close because I look back and I have no regrets. I don't feel like I took too much time for myself. And I was really clear about that time being my priorities are practicing good medicine and raising these kids. And those are my priorities. And I was okay. I didn't feel like I needed to take a beach vacation. And, and yes, there were a lot of nights I was tired. And yes, a lot of nights I was like, oh my God. But I wanted to cook real meals for my kids. I wanted to do as much as I possibly could. Did I do what I could do if I didn't work? Absolutely not. Probably a fraction. But I tricked them into thinking I did because they think I was around all the time. And so I can now be at that apex and look back and say, well, I love everything that I did. No regrets on that at all. And I wish it's different for every person. So I don't want to say to younger people, oh, that's the way to be. But I'm telling you at this point, and I had a lot of good advice along the way, and of people I'd run into at meetings and like, do what you love. There's no right or wrong. And I don't have a problem saying no. I say no to a lot, but I say yes to a lot that I just find so interesting. I can't stay away from it.
Yeah. Yeah, we got really off track.
I know. Okay, so this is you might want to cut out all that stuff because this is actually a really good thing to think about. This is my second page, and I'll wrap this up because I know you have to go to New Orleans.
Oh, my flight's at midnight. It's fine, and I still got to pack, so don't worry about it.
Okay, you don't really. That's the other thing. I pack very lightly. Simplicity.
Yeah.
Okay, so this is the other set of notes, and this is the other thing I've been thinking about a lot is subtraction and running lean. So the first part that we've been talking about is all about ways that you could be lean in your practice, like really look at your employees, look at your bottom line, everything has value. By the way, I got rid of my shredder because I was really pissed off. It was $170 a month. And I was like, and I realized you only have to have a cross-cutter shredder. I got rid of the shredding company. I got a shredder in here and my people shred. Now I trial it. If they hate shredding, then I get the shredder back. But I look at all these things like high and low. So the point of subtraction is it doesn't equal doing less. This quote, to attain knowledge, add things every day. To attain wisdom, subtract things every day. I listened to a podcast about this about a year ago. It was on NPR. It was just random. And it really struck home because in business, everybody's coming to you telling you how they can add, right? So we listen to your podcast. I listened to your podcast. Not yours, BackTables. Was it yours? BackTables.
It's not mine.
No,
I'm just some lady.
Okay. Oh yeah. I'm just some girl, so we're good. And it was what this person can do for OBLs and adding certain things to it. And my response was, you know what would really be worth spending money on? Having you come in and take that away from me. That was my first thought of go away. Don't cost me more time, more energy, not just money, more time, more energy, paying attention to you. That's why I got started to think about subtraction. And I listened to a podcast and said, nowhere ever do you have a consultant that you pay that leaves and says either you're doing great or eliminate 12 of these things. Not in a small business, right? The consultant gives you 4 pages of line items of what they're going to do for you, which then you have to manage. Okay, so then I listened. There's very little on this. There was a Lego study. There are these kind of famous studies now that I've seen and all the sources I've seen on this. We're not wired to subtract. We are wired to add. So they did this Lego study. This engineer was looking into stability, and he made his Lego structure unstable. And he put one little Lego on it that needed to be taken away before the structure was stable. Like 98% of people added to try to make the Lego structure more stable, even when he charged them, fake money, but still charged them for the Legos. The person who took the Lego away was his 5-year-old.
Well, so I guess we're just wired to add stuff to try and kind of like address problems that maybe we created ourselves.
Yes, that's a human psychology. I don't know about other countries, but this is a psychology in business, at least in this country, that we're taught and that we value, right? We value somebody who can speak in a complex way and solve complex problems and add complexity, right? Like the device that has 14 different things. No, we don't want that. We want a compy and a glide wire and maybe a steamer. And then we can just steam our own catheters. There was another study where they made a chef made a recipe and put in some overpowering ingredients. And they gave it to a bunch of people and said, how do you improve on this recipe? And out of, again, the 100 people who looked at this, all but 2 of them added more ingredients. And the key to this was you took away. So it's how we view the world. The takeaway, what can I take away? That's how I'm viewing now of running lean. I don't like that term because it makes it sound cheap, but how do we value subtraction? That Marie Kondo gal, whatever her name is, her thing wasn't just organization, hers was subtraction as well. And we don't just buy more bins, and now we have organized bins. take away the stuff and then take away the bends. And that's where you live. And this is all study and subtraction and happiness. But when I look at from a company level, why are we wired to add people, to add complexity, especially in medicine, when what we care about is the doctor and the patient?
It all comes down to that, right? Doctor and patient relationship. That's the thing that adds value.
Yeah. And I think you also have to build to the point that you can then start to subtract. So if you're brand new, you can't start with a subtraction mentality. You have to start with a build. I need more information. I need more people coming by. I need more device. I need to hear this. I'm going to need a phone system. And that phone system may be too complicated for you, or maybe not. You're never going to get that right until you have those 2 years of data. And then you can start. So you have to build up. You have to be kind of at least above the tree line before you can start talking about what to subtract. And I think that's important too. I mean, just having that concept of subtraction in mind as you go through life. I thought about that mostly from a business perspective, but when you go through life from a personal perspective too, obviously for me. And when I had younger kids, it was more. And now it's less for sure. But
yeah, you're about to head into that era, right?
Oh yeah, I'm in it.
Oh yeah.
It's fantastic.
Rub it in.
I know. No, I love it. I'll babysit your kids any day.
Sounds good.
One more thing. My staff is always laughing at me because I'm always like, and one more thing. I did read this and I don't really know where to put it, but the capitalist economy model is a perpetual growth, which leads to a time famine.
A time famine? What do you mean?
We don't have time because we're in a capitalist model, perpetual growth. I like capitalism. I think it's great. I mean, it's helped me, but the concept of, this capitalist model is that we're in a state of perpetual growth, right? And when you think about that concept, people probably ask you, "You're going to have more kids?" And you're like, "Dude, I have 3.
Yeah.
How many more do you want me to have?" Right? What do I get asked a lot? Are you building another center? Are you taking on more physicians?
Right.
Right? And so people are giving me that message that me being valuable, successful results in me needing to have many people working for me. When they find out I have the same 6 people and I do all this stuff, that's what people can't figure out. I don't need more people to do this. I need actually fewer people to get out of my way so I can get done what I need to get done. And you do run into a time famine because everything you add to the system takes my personal time.
It's true. Yeah, kind of like one of those be happy with, figure out what you need to be happy and get to that level, and then don't keep striving.
Yeah, and it's important that I think that's what we should lead within these talks is like, where is your happy point, right? If you want to make $10 million a year, then get that grind going.
Yeah.
And Michelangelo was said to see the angel in the marble, and he chipped away until the angel was set free.
That's neat.
So that's not exactly what the book talks about, but y'all could read the book. I find it interesting. It has to do with finance and how kind of the noise around finance. So the book is more about banks and finances were meant to invest in small businesses, and the small businesses grew to develop a product. And then what happened is the bank realized that they could also make money off of that business by being their credit card agency, right? So they were just loans. And Citibank was the first person who did this. Now they're the credit card. Okay, so look at Siemens. I bought my product from Siemens, and now I pay $80,000 a year to be their warranty, right? I can't go hire a guy. I got to continue to pay Siemens, right? Siemens got me by, all the companies will, you get your equipment and then they have a grace period and you really need that. But then you realize, okay, now I've signed up for this thing. And by the way, Siemens is loaning me the money for it, which also makes them part of the banker, right? So this is how the finance world has really taken over, and they become a big wheel where like 75% of the jobs are all finance related. And what finance used to be a long time ago was we finance small companies to spur growth. And now finance just finances finance.
You just said finance like 10 times.
Yes.
Totally get that.
It's all a financial wheel. And we're just way over here on the side.
Oh, yeah. Just trying to do our little piece. Just trying to do some angiograms.
And think about companies that people want to invest in right now. It's not the Starbucks because they make lattes. People want to invest in the companies that have bought the most Bitcoin.
It's true. Yeah. Oh my gosh, the crypto thing is just this other crazy thing. Okay, Mary, I got to go pick up my oldest daughter. But Dr. Costantino, thank you for being on the show today.
I know it's a lot and kind of chaotic thinking, but I've thought a lot about this over the last couple of years.
And you made it like very clear, like how all the stuff applies to the OBL and managing your business. So it was good. Okay, I have to ask you about other stuff later, but I'll just text
call
you.
me anytime.
Okay,
Anytime.
bye.
Thank you so much for listening. If you haven't already, make sure to subscribe and follow, rate the show 5 stars, and share with a friend. If you have any questions or comments, direct message us at _BackTable on Instagram, LinkedIn, X, TikTok, or Blue Sky. BackTable is produced and hosted by myself, Aaron Fritz, and co-hosts
Chris Beck, Sabine Don, Michael Barraza,
And Ali Behati.
Our production team is led by Kieran Gannon,
Aaron Bowles,
Gabe DeGrazio,
and Josh Spencer. Design and digital marketing led by Brian Schmitz.
Social media and PR by Ann Dang, Manisha Naganathanahali,
and Manbir Singh Sandhu.
Administrative support provided by Judy Dela Cruz.
Thanks again. See you next time.